It's my pleasure to be here to talk about adolescent suicide. It's a difficult topic, but I learned a lot doing research about this and want to tell you about some of the things that I've learned and some of the things that we can be aware of and attentive to and what we can do about this problem. I wanted first to say thank you for all the people who helped put this event together, particularly Darcy and our office manager, Pauline, and all the 5E staff who volunteer for this program, and all the community agencies and you in the community. It really is a labor of love, and it's a really terrific event year after year. So in our community recently, we've had 2 high school students who've died and 2 UCSB students who've died. And the cause of death isn't certain, but there's at least a reasonable chance that these were suicides. And they very, very deeply affect the community. Conor O'Keefe was a high school student who was hit by a train. When they had a service for him at the Marjorie Luke Theater, there were 800 people who attended. And I think when these events happen, they really affect the whole community. It's not just the family and friends, but it really ripples through the whole social network of the community and has a deep impact. And one of the things that I think about when I look at the topic of adolescent suicide is that it seems to me a common theme is that for these adolescents who get depressed and get to the point where suicide is the only option they see to choose, it seems to me they become really unable to have somebody in their life who recognizes them, appreciates them, can be with them in what they're going through and offer them hope. I'm struck by how isolated adolescents get, even when they seem to be in the midst of good schools, good teachers, good peers. They feel alone and they see no other option. Suicide has a tremendous impact. There was research decades ago that there was a very significant impact on about a half dozen people when an individual suicided. Current research says it's well over 100, and that about a third of those have some significant life disruption from the event. It affects them very deeply. I think that social media and the way social networks have changed have probably had an impact on this. People who know a suicide victim begin to develop more often thoughts of suicide themselves. There's really a kind of contagion, particularly among younger people who suicide, that happens among their peers, and I'll talk about that in just a little bit more later on. But I wanted to tell you about one teacher, it's the teacher who wrote this note, who worked in Colorado Springs in the school system there. And in Colorado Springs, they had one of these contagions where in a single year, about 15 young adults, high school students in that community suicided. And this teacher was talking with a parent at what they were supposed to have a parent-teacher conference. The mom explained that her daughter was in the hospital because she'd made a suicide attempt. And she asked the mom if she would bring the student this note, and she wrote this note for the student. One of the aspects of that event is that the young woman who made the suicide attempt had peers. They have a program in Colorado Springs called Safe to Tell. Peers are encouraged to speak up if they think one of their peers is in trouble. They had, and the police had gone to the home and stopped her before she completed the suicide. So it'll take a few minutes, but this 3 or 4 minutes is well worth watching the interview with this 25-year-old teacher. It was interesting because I searched for a video of this teacher. The place that I found this was from a New Zealand television station. I learned in the course of doing this that New Zealand has the highest rate of adolescent suicide among the 43 developed countries. So they're paying a lot of attention to this.
A teacher in Colorado wrote thank you notes to all of her students after finding out one of them was having some severe personal problems. Brittany Darris spent 2 months writing personal notes, and I'm talking long letters, look at those, to each of her 130 students. She wanted to remind them of the things that made them special. Her post has since gone viral and been shared many, many times. Brittany teaches at Rampart High School in Colorado Springs. She joins us now to tell us the rest of the story. Good morning.
Good morning.
Good morning. How are you?
Doing great. You know, this is just such an unbelievable story. Tell us how it all started, Brittany.
It all started at parent-teacher conferences when a parent came up to me and said that her daughter had been missing for several weeks because she had attempted to commit suicide. And so mom came in and she just said, listen, I have a list of teachers. Some say yes, some say no. And the ones that say yes, my daughter felt comfortable sharing this story with. And so she proceeded to tell me that her daughter had deleted her social media accounts. She had left letters to her loved ones, and she was in the act of committing suicide when somebody made a safe detail report and the police came and they stopped her.
And so you asked the mom if you could write her a personal note, right?
Correct. So at that point, as a teacher, you feel pretty helpless. I didn't know what I could do besides reach out to her and just let her know that we miss her and we care about her and we hope that she's doing well. And so I did give her mom the letter to have her brought at the hospital, and her response is really what encouraged me to write these letters. She told her mom in tears that she couldn't believe somebody had such nice things to say about her, because she was genuinely convinced that if she was not part of this world, that nobody was going to miss her and that it wasn't going to make a difference.
Wow.
Why does that word from you, what does that say about her life and what she was going through, that she wasn't getting that feedback from other places, more traditional places, I suppose, than one of her teachers?
Well, it was really surprising because this is a student who has friends, is part of groups at school, does very well in school. And so I think that's the hardest part about the whole situation is we don't know who as a student is struggling and who is not, because people who are seemingly very well are struggling. They're struggling with depression, they're struggling with pressure, they're trying to survive it, and they're really having a difficult time with that.
So Brittany, what was the response? You lay out letters, we saw them all laid out. And not just short little notes. For 130 kids, it had to take a long time. I'm just curious, were the kids just completely touched to hear nice words about themselves?
It was so sweet, the response that I got from the students. I had a range of everything from students reading their notes and smiling. I had other students, one of them jumped up in her seat and she held her card up in the air and she said, "This is the best thing I've ever gotten. I'm keeping this forever." And then another one of my classes, I was sitting at the front of the room as they were all reading their cards, and they all ran up to me and wrapped their arms around me and gave me a hug. Another one, every single one of my students on the way out the door gave me a hug and just said, "Thank you for the card and thank you for a great year." So it was really great to see how excited they were to get these notes that were personal to them, that meant something to them.
It sounds like we may not know our kids as well as we think we do, or what they're going through.
I think so. I think that a lot of times, like I said, there's this disconnect where somebody might seem like they're happy and they're doing really well, and then they actually are having struggles. And so something that I do is at the beginning of every week and the end of every week, I just ask my students, how was your weekend, or what are your plans for this weekend? And that lets me get to know them and what their interests and passions are. And I think having those conversations lets them know, hey, I care and you're special and you're unique, and I want to value you for what makes you unique.
Or, you know, you forget how one kind word, you know, you maybe don't hear it a lot. And it's just from someone who's not your mom, maybe, makes such a difference.
Yeah.
And Brittany, you're only 25 years old, right?
That's correct.
Oh, well, what a great teacher. The kids are lucky to have you, and what a great idea. You going to do it next year?
I would love to do it every single year after I saw the responses this year.
Oh, it's so nice. Well, congratulations, Brittany. It's a wonderful story, and best of luck to you.
Thank you so much.
Thanks, Brittany.
She would get to know her students as individuals. She would ask them, what are they doing for the weekend? She would get to know more about them than their performance in the classroom. And then she would be able to appreciate about them what she wrote in those notes, and I'm sure in other ways. And it made such a difference for those kids. And I think that it's so easy to miss what's really going on with an individual. That's just one of the things that strikes me, because in many of the articles that I read about adolescent suicide, parents would say and teachers would say, I had no idea about that child. I would not have put that child up high on the list of individuals I was worried about or thought might commit suicide. So the power of reaching out as an individual to make that kind of human connection is not to be underestimated for any of us. So here's some data about suicide. These are suicide rates in the United States, 1999 to 2014, and for men and for women, and overall, the rates have increased by 25% in about 15 years. So that's a pretty substantial increase. And when I looked further back about the suicide rate for adolescents, it's currently 3 times what it was 50 years ago. So there are things that are different for adolescents now than decades ago that make life more challenging. And this is a plot of the same period of time. On the left-hand side is women, and on the right-hand side is men. And there's several things to see here that I think are interesting. One is, overall, the rates for women are substantially less than men. Men commit suicide at about 3 to 4 times the rate that women do, and that's true for adolescents as well as adults. A second take-home is that if you look at the ages of 45 to 64, both for men and women, that rate of suicide is climbing the most rapidly out of all the age groups. And I think that reflects the demographic that you've probably heard about middle-aged whites who, particularly in Appalachia, the industrial Midwest, and other areas, rural areas particularly, have lost so much over the last 10 and 20 years, and who have high rates of suicide, but also very high rates of alcoholism and other kinds of related problems. A third observation for me about this graph is that if you look at men age 75 and above, which is the highest rate of suicide among any age group, it's been declining these past 15 years. Now, I don't know that I've seen anything about that. And I think often we tend to notice the news that is alarming or worrying more than we do the news about things getting better. But older single men are by far the highest risk group for suicide, but their rates have been declining. And then down below at the bottom, you see the rates of suicide for ages 10 to 14. And this is an age group that has had a remarkable increase over the last 15 years. This slide is for ages 10 to 14. If you look at the rates of suicide, they've been climbing, especially recently, and climbing much more for girls than for boys. The rates for girls in this age group have tripled in the last 6 years or so. And now suicides account for more deaths in this young adolescent group than traffic accidents do. Part of what I noticed as I read the literature is that the focus on adolescent depression and suicide prevention used to be on the high school population. It's now shifted downward to the middle school population and even into the late elementary school population, because the rates of depression and the rates of suicide in those age groups are substantial and increasing. This is just another summary of the 10 to 14 age group, and you can read for yourself, but the take-homes are particularly that for girls the rates have tripled between 2007 and 2014. Now, nobody really knows exactly why. Probably social media plays a role. It's so much easier for teens to be shamed and humiliated through social media. There was some speculation that puberty, which used to be at age 15 to 16, and the average age now is 12 for girls, although I think it's been at that age range for some time, not just recently. And the onset of puberty is when there's a spike in the onset of depression, particularly for girls. And then another factor that I wondered about is that firearms have always been the most lethal means of suicide, and that's true for adolescents as well as adults. But what has been increasing as a means of suicide is asphyxiation. So when you look at overdoses, most overdoses don't succeed in suicide. But when you look at asphyxiation, it does. Here's some, taking a step back, some bigger picture data, and just a few interesting observations about this. The areas in red are the highest rates of suicide, more than 13 per 100,000 population. And you can see that Europe, as well as Russia, and much of Southeast Asia and Australia have very high rates of suicide. In Russia, the rate of suicide is 44 per 100,000. So it's almost quadruple what it is in the United States. And the Soviet bloc countries, all of them, have very high rates of suicide. It's also striking that Latin America has many countries with low rates of suicide, and that corresponds to me with, when you look at ethnic groups, Latinos tend to have lower rates of suicide substantially compared to whites. And the United States is in the middle here. This is another graphic that looks at the ratio of male to female suicides. The darker colors mean higher ratios of male to female suicides. And again, you can see that some of Europe, Russia have very high rates. The United States is kind of in the middle. And then some of the other countries are closer in ratio of male to female suicides. There's one country in the world where more women than men commit suicide, and that's China. Now, I don't know why, but it's the only country in the world. And here's the United States, and the darker colors, again, are higher suicide rates, and you can see that much of the Mountain West, the Appalachian Territory, northern New England have higher rates. California actually has fairly low rate of suicide as a state compared to the states in the United States. And this is the rate for teenagers of suicide rates across the country, and it parallels the adult rates as well. California, again, has is at the low end of the spectrum in terms of the rates of suicide. And in general, urban areas tend to have lower rates of suicide, rural areas higher rates, and that's the graph on the right there. And just a few other graphs with some data. This is the suicide rates by age, and you can see that older men have the highest rate and that there is a spike in the 45 to 64-year-old group. And this is by race and ethnicity. So on the left-hand side, whites have a very high rate of suicide, and particularly white men. The other group that has very high rates are American Indians and Alaskan Natives. This is actually a big concern in Canada with the Indigenous people of Canada because they have very high suicide rates and very high adolescent suicide rates. And you can see that African Americans, Latinos, Asian Americans all have lower rates, substantially lower rates. And then one other observation that I think is important to note is that in a study where there was a look at states that had passed same-sex marriage legislation in comparison with states who had not, there was a substantial reduction in suicides by LGBT youth, 14%, in the span of just, I think, a 2 or 3 year period. So the cultural context for individuals makes a big difference in terms of suicide risk. The observation at the bottom is that Supportive family, a safe and welcoming school, legal protection, equality in the eyes of the law can provide the foundation necessary to thrive and flourish in adulthood. So seen through different lenses, that's a common theme as well. Here's some data about the method of suicide. And you can see the bottom big blue is firearms. And that, particularly for men, accounts for a very substantial amount of the means of suicide. What you see toward the top in the lighter blue is asphyxiation, suffocation they call it. And again, that's increasing in terms of the percentage of the time that it's used as a means to suicide. And the worry is that unlike firearms where you can do something about securing them, that's a very hard problem to address. And I think in an age of social media, and when you look at the phenomenon of contagion, this was true in Colorado Springs, that's the way that a lot of the high school students in Colorado Springs ended up suiciding. So what are the risk factors for adolescent suicide? One underlying theme is that mental illness plays a significant role. And major depressive disorder, a major depressive episode, is something that I think we all think of as that puts a person at risk, potentially, for suicide. But it's also true that anxiety states, and particularly panic attacks, agitation and aggressive states, and impulsivity also correlate with suicide attempts and successful suicides. So even the individual who doesn't have a major depression can still be at risk due to other mental health factors. And identifying these and intervening on them is really critically important in helping adolescents at risk. Alcohol plays a role that's very significant in suicide. If you look at the rate at which individuals are intoxicated or have been drinking when they make suicide attempts, it's substantial. Other drugs play a role as well. And then access to firearms also plays a very substantial role. So these are three things that I think it's important always to keep in mind when you're thinking about the risk for an adolescent for suicide. Then there are many other psychosocial factors that play a significant role. And many of these things underlie good health generally or risk for poor health. So poverty, housing and food insecurity, family stresses of different kinds, lack of safety in the community, problems in school, and then peer problems of different kinds, relationship losses, physical or emotional abuse. All of these are risk factors as well for suicide. And I think what happens is that the vulnerable individuals, when you combine them with these events and a series of these events, that is how things kind of line up when an adolescent finally reaches a tipping point and makes a suicide attempt. And down the bottom, social media, cyberbullying are a substantial problem these days. And I'm not sure anybody knows quite what the right approach is for that. Now, there's another set of risk factors that surprised me, and this came out of studies in Palo Alto. So Palo Alto is Silicon Valley. Gunn High School, which is in the neighborhood where Steve Jobs grew up, has a very high rate of suicide. They had one cluster of suicides, and then 5 years later, another cluster of suicides. And you would think these are the adolescents who have every advantage you could think of. They come from families of means. They go to the best schools. They have all the resources that they would need, all the help to succeed. But in fact, and the way this came about was that there was a teacher at Yale who was studying poorer school systems and risk factors for depression and suicide. And that person needed a comparison school, so she chose a wealthy Connecticut suburb. And she expected that that would really illuminate the differences in terms of how kids did. What she found was that those kids were at more risk of depression and suicide than the poor kids were. And she didn't understand it. She went and studied middle income schools and groups of adolescents. And what she found was they were at the lowest risk. So it was like a U-shaped curve. The very poor kids were at very high risk, but the very affluent kids were at even more increased risk for depression and suicide. And it seems to be a constellation of very high achievement expectations, self-worth grounded in achievement, families that praise for achievement but don't really have emotional connection. Remember that teacher who would ask, "What are you doing on the weekend?" and would remember that and would notice the person apart from how they were doing in the class? That seems not to happen often in affluent communities. And the adolescents end up with little sense of agency, little sense of themselves as effective in influencing what's going on in their life. They feel a sense of being caught up in something that they can't get out of and that they have no choice about. So this is a quote from a Newsweek article about Colorado Springs, just some observations that adolescents don't have experience and skills getting through stressful times. A breaking point can seem to an adult insignificant, but it's not that experience for the adolescent. And risk factors can line up like traffic lights, where the thinking and movement toward attempting suicide is one event after another that just kind of pushes the child over the edge. One light might be a fight with a parent, another a flunked test, a breakup, a peer suicide, and the final act is often on impulse if everything else falls into place. And this was one of the really mysterious things to me in learning about this, is that parents and teachers were often surprised at who suicided in their community. They just didn't see it coming. A couple of words about depression in adolescence. This is a study from pediatrics where now pediatricians nationally do an assessment about suicide, depression and mental health risk factors every year, the same assessment. So they have data now going back about 8 or 10 years looking at how are adolescents doing year to year in terms of their rate of suicide, for instance. And what this study showed was that between 2005 to 2014, the rate of major depressive episode within the last year increased from 8.7% to 11.3%. So that's a very large increase in a relatively short amount of time with good objective data that adolescents are experiencing more depression, more major depression than they did in the past. Another result of this study was that the number of kids with major depression went up on the order of 35, 38%. The number of mental health contacts for those kids didn't change. So there wasn't more access to services, although there was a rise in the rate of more intensive services like hospitalizations. But the total number of contacts didn't change. So here's another look at that same data. 37% increase, and in the age group 12 to 17, 3 million teens had a major depressive episode in the last year. So this held for kids up to age 20 and wasn't true for kids up to age 25, but for adolescents it held. Now another phenomenon that's, I think, fairly mysterious is suicide contagion. So in Colorado Springs in 2013, there were 13 teens who suicided within 1 year. And there is now sociologically a study about how behaviors are contagious. So if you're in a social group where there is a higher rate of people who smoke, you're more likely to end up smoking. If you're in a social group where there's a high rate of obesity, you're more likely to become overweight. And other kinds of behaviors seem to get transmitted through social connections in ways that I think nobody really understands well. So somehow we're having an influence on each other, and sometimes it's not closely connected people, it's just people you have some contact with, where behaviors and actions are transmitted through the social group. In some way, this seems to happen with suicide. In fact, the CDC has studied this and says it's not that different from the spread of disease. It's social, but it's very similar. So in Colorado Springs, they had this high rate of suicide. Television and newspaper coverage plays some role. Social media may play a larger role these days. And here was a quote I thought was very interesting, that the Instagram pages for kids who kill themselves sometimes contain hundreds of comments about how beautiful the deceased were, how they can rest in peace, how there should be a party for them in heaven. So there's a kind of romanticization and engagement in the whole drama of suicide for other adolescents that can occur through social media that may be part of this process. There's advice now to the media not to glamorize or romanticize reporting of suicide, to do it in a way that's more simple and factual, and to be aware of the role that media can play in spreading suicide. This is a young woman who was a student in Colorado Springs and is now a survivor of a suicide attempt and an advocate for good mental health services. She was in 8th grade. She set a date for her suicide. She's now 17 and active in suicide prevention efforts. In 8th grade, she had anxiety and depression. She couldn't sleep. Her grades were slipping. She was losing weight. She probably had a major depressive episode at that point, and it wasn't recognized. Her friends sensed that something was wrong, and they staged an intervention and convinced her to ask her mother for help. She said, "I was physically shaking. I could hardly breathe, but I had 30 seconds of bravery to say out loud, 'Hey, I'm not okay.'" She started therapy. She's better, and she shares her mental health story publicly now and advocates for suicide prevention. So there's a good case where friends noticed, spoke up, got help from the parents, and it made a real difference. Here's a little bit of the story in Palo Alto. So this was the study by that professor I told you about, that in the more affluent school, the proportion of kids who smoked, drank, used drugs was higher than in the poor school, as was the rate of serious anxiety and depression. And depression in the affluent community for adolescents was 3 times the national average. I mean, that's extraordinary to me. When kids ranked their parents' top values, and they were given a list where half the values were related to achievement and half to well-being and character, those kids who chose more achievement-related goals as more descriptive of their parents correlated with more personal problems for those kids. These are adolescents who at times felt catastrophically flawed if they didn't meet the highest standards of success, and they were remarkably emotionally isolated from their parents. Some of these kids described that their parents would not be home until late evening, day after day. So there was no dinner together, there was no evening time together, and these are parents who are high up in Silicon Valley and other kinds of high-tech jobs. I thought I couldn't do this talk without mentioning 13 Reasons Why. Does everybody know what 13 Reasons Why is? So it's a Netflix series now about an adolescent girl who suicided. And I haven't watched it yet, but what I understand the plot is that she planned her suicide and in part as a revenge against people who she was angry at, who had mistreated her. And she made a tape for each of the 13 people, and delivered it to the left it on the doorstep of the boy who she wanted to be her boyfriend. And there's a lot of controversy about this series. There are some critics who say it's well done dramatically. Some people I've talked to who have watched it have said they don't agree with that. And there's a lot of criticism of this is a kind of dramatic presentation that could actually be damaging for adolescents. And there are school districts that have tried to restrict access to this, who've said that they think it's puts kids at risk, puts vulnerable kids at risk. There's a quite graphic depiction of suicide in the series. And the counselors and adults seem in this dramatic series to be absolutely clueless. This young woman tries to tell her counselor about a rape that happened to her at the school, and the counselor just is really tuned out. And in looking at the psychological experience for individuals who'd made a suicide attempt as compared to those who had not, the themes were, not surprisingly, either a lot of negative feeling towards oneself or interpersonal problems where somebody felt profoundly isolated or angry and vengeful toward people who had hurt them, which is kind of the basis for the 13 Reasons Why. And then I thought I would finish with some new findings in assessing suicide risk. And I should say at the start, the mental health field's ability to assess and predict suicide is almost non-existent. So there was a study done out of a psychiatry emergency room where the clinicians were asked to assess who was going to go on to attempt or complete suicide and who would not, and they were not able to predict any better than chance alone would have predicted. So I think we have to be humble. Again, it's how did that happen to that child kind of situation, a different version of that. And certainly we know risk factors. You know, we can pay attention to the factors that put somebody at risk and address those, but really understanding who's going to go on to act, we don't do very well. And, you know, clinical interviews depend on a person being honest and really telling you how much risk they're at. And for various reasons, people may not be in touch with or willing to communicate that. So here was a new approach that was interesting. There's a psychological test called the Stroop test, where you are shown a word, and instead of reading that word, you have to say what color that word is. You follow me? So one of the things they're looking at is how fast can you name the color of that word? Because words have emotional content, and they trigger processes in your brain that interfere with saying the color of the word. And when they did Stroop tests with a population that was in a psychiatry emergency room, suicidal individuals were found to pay more attention to suicide-related words than to neutral words. They were slower at being able to name the color of the words that were associated with suicide. So this is a way at getting at kind of unconscious mindset and feelings that a person themselves may not even be aware of. And then there's an implicit cognition test that's been done recently. This has been studied at Harvard. I read about this years ago in looking at racial bias, because it's a way of getting at unconscious racial bias. But when they pair words like lifeless or suicide with words that indicate self or other, and compare how somebody does with I'm not exactly sure how the test works, but linking those two words, those people who were more risk at suicide would be quicker to link death and me type words together than individuals who are not at risk of suicide. And that group had 3 times the rate of suicide attempts in the next 6 months as the group that didn't have that quick connection between the words. So again, a way of getting at an assessment that's a different kind of assessment of somebody who's at risk of suicide. By the way, none of this is in clinical practice to the best of my knowledge. And then there's the big data approach to assessing suicide. So at Harvard, they took almost 2 million medical records and analyzed them for 30,000 different factors, looking at what predicted suicide. And after crunching all this data, they were able to predict almost half the suicide attempts, sometimes years before they happened, based on a variety of factors in the medical records. They found that medical illness, and particularly gastrointestinal symptoms and infections, played a significant role predictively with suicide, which was unexpected. Some other findings: depressed individuals with increased awakening between 4 and 5 a.m. are at higher risk for suicide. Individuals with low baseline cortisol, low response to cortisol challenge are at higher risk for suicide attempt. So these are all new attempts to find biomarkers and clinical markers that would predict suicide, because there's a search to do that. We're so poor at being able clinically to do that. So what are protective factors and what can we do? Certainly restriction to firearms and lethal means is important. So in the ER, when we see an adolescent, we always talk with the parents about home safety as much as possible, no access to medicines and so on. Identifying and helping with alcohol or drug problems, and identifying and helping with mental health problems. Those things are all key. Other protective factors are working hard to have a stable and caring family, good educational experience, developing an adolescent's ability to solve problems and cope and develop a sense of agency. It helps when kids have a sense of achievement and success in any arena: sports, arts, school, whatever it may be. Feeling that an adult knows them and cares about them, which we've talked about. So what can we do in Santa Barbara? Same kinds of themes: identify and treat mental health problems, secure lethal means, address alcohol and drug problems. These are big challenges. Services for adolescents can be very difficult to access, particularly child psychiatry. I think we also can reduce stigma and increase knowledge about mental health for teens. Carrie and I were talking about the Mental Health Matters curriculum, which is in every school in Santa Barbara now, 6th and 9th grade, that talks about depression and other topics, and reduces the stigma and increases the knowledge for teens. Communicate with your adolescent and get to know them as a person. And don't hesitate to talk to his or her friends if you think they're in trouble. Safe to Tell is a public health initiative in Colorado Springs which says, if you think somebody you know is in trouble, speak up, get help for them. Another initiative that I heard about recently is sending a note after an emergency room encounter for a suicide attempt at 1 month and 6 months and a year has substantial benefit for that person in the course of their recovery. And I was thinking, why would that be, that a note from the ER from one encounter? And I think what it may be is that's a place and time when you're talking in a real way about the distress you're in, and you might not have talked with anybody else about it. And a note from somebody who you connected with then can make a difference. And asking media to report about suicide respectfully. So these are our kids, and let's do well by them. Yes, that's what you want to do is ask, and then make a judgment about, is the person giving you an honest answer? Sometimes you have the sense that they're not giving you an honest answer. And in those cases, and in generally too, you want to talk to as many sources as you can to get a good assessment. Because you're seeing them one time, say in an emergency room, but their parents, their teachers, their peers know a lot more about them and how things have gone for them.
Freer society about what our spiritual choices are?
I think that's a great question, and I do think that the place that organized religion has in our lives has changed so much over the decades, and I think that has had a significant impact. I don't know the particulars about that, but I do know that being part of a religious community and having a faith has many benefits emotionally and relationally for people. So I'm sure that plays a role.